In American politics, the health of a sitting president is not just a personal issue, it's a matter that resonates far beyond the walls of the White House. The well-being of the nation's leader is closely tied to the stability and confidence of the country itself. When a president faces health challenges, it can have ripple effects on everything from the stock market to international relations, and even the morale of the American people. The public's interest in a president's health is not just curiosity. It's rooted in the understanding that the leader's ability to govern directly impacts every citizen. People gather in living rooms, coffee shops, and online forums, debating what a president's medical report might mean for the future of the country. When former President Trump, at 79, mentioned undergoing an MRI in October 2025, it immediately became headline news. The announcement was brief, but it set off a wave of speculation. Was it a routine checkup, or was there a more serious underlying issue? The public and the media alike wanted answers, and the lack of detail only fueled more questions. Journalists scrambled to uncover more information, while headlines speculated about the president's fitness to serve. In the absence of a clear explanation, rumors and theories spread quickly, highlighting just how much the nation depends on transparency from its leaders. The public's right to know about a leader's health is not just a matter of curiosity, it's a cornerstone of trust in democracy. Voters want to be assured that the person they have chosen to lead the country is physically and mentally capable of handling the immense responsibilities of the office. This essay delves into the reasons why a president might need an MRI, from routine screenings to the investigation of specific symptoms. It also examines the protocols in place for disclosing such information to the public, and the challenges that arise when medical privacy collides with the public's right to know. The implications for transparency are significant. How much should the public be told? Where is the line between a leader's right to privacy and the nation's need for openness? These are questions that have no easy answers, but they are essential to the functioning of a healthy democracy. Ultimately, the discussion about a president's health is about more than just one individual. It's about the values of transparency, accountability, and trust that underpin American democracy. As we explore this topic, we are reminded of the delicate balance between respecting personal privacy and serving the public interest. Understanding President Trump's MRI requires knowing what an MRI is and its medical use. An MRI provides detailed images of internal body structures without ionizing radiation. It's used to diagnose conditions like tumors or neurological issues, not for routine checkups. The process involves lying in a tube-shaped machine, while magnetic fields and radio waves create images. MRIs are reserved for specific medical concerns, not general screenings. The White House's claim of routine use contrasts with medical experts' views. This discrepancy fuels skepticism about the true reason for the scan. In recent days, medical experts have publicly challenged the White House's assertion regarding President Trump's recent MRI, sparking a broader conversation about the use of advanced imaging in routine medical care. The claim that the MRI was simply a standard precautionary measure has been met with skepticism from many in the medical community, who point out that MRIs are not typically performed as part of a regular checkup, especially for someone without clear symptoms. The MRI procedure itself is a sophisticated and expensive diagnostic tool, usually reserved for cases where a patient presents with specific symptoms, or when doctors suspect a serious underlying condition. Unlike basic blood tests or routine physical exams, MRIs are not part of the standard battery of tests for healthy individuals. Dr. Jonathan Reiner, a prominent cardiologist and medical commentator, emphasized that MRIs are not used for general screening or routine checkups. Instead, they are ordered when a patient reports particular symptoms that warrant closer investigation. For example, if someone experiences unexplained headaches, sudden memory lapses, persistent back pain, or other neurological or musculoskeletal issues, a doctor may recommend an MRI to get a clearer picture of what's happening inside the body. Dr. Reiner outlined several key reasons why a physician might order an MRI: to investigate neurological symptoms such as dizziness, confusion, or weakness, to assess musculoskeletal problems like severe joint or back pain, or to evaluate heart concerns, especially if a patient has reported chest pain or abnormal test results. In each of these cases, the MRI is a targeted tool, not a routine measure. Symptoms like memory lapses, unexplained headaches, or persistent back pain are red flags that could prompt a doctor to order such a test. The decision to proceed with an MRI is always based on a clinical judgment that something more serious could be at play, and that further imaging is necessary to rule out or confirm a diagnosis. For instance, a patient complaining of lower back pain that doesn't improve with rest or medication might be sent for an MRI to check for nerve compression or other spinal issues. Similarly, if a patient describes new or worsening neurological symptoms, doctors may use MRI scans to look for evidence of stroke, tumors, or other abnormalities. The MRI provides highly detailed images of the body's internal structures, allowing radiologists and physicians to detect subtle changes that might not be visible on other types of scans. This level of detail is crucial for diagnosing serious conditions early and accurately, which can make a significant difference in a patient's treatment and prognosis. Dr. Reiner's analysis of the situation suggests that there was likely a specific medical reason for President Trump's MRI, rather than it being a routine part of his annual health check. This implies that the decision to conduct the scan was driven by a particular symptom or concern that warranted further investigation. In the medical field, such decisions are rarely made lightly. The use of an MRI is almost always prompted by a clinical finding or a patient's report of new or troubling symptoms, not simply as a matter of protocol. This expert perspective challenges the official narrative and raises important questions about transparency and the public's right to know about the health of their leaders. As the discussion continues, many are calling for greater openness and clarity regarding the circumstances that led to the MRI, underscoring the need for honesty in matters of public health. In 2025, President Donald Trump's public appearances have drawn intense scrutiny, with observers and media outlets closely monitoring his health. Every step, gesture, and word has been analyzed for clues about his well-being, especially after rumors began circulating about a recent MRI scan. The speculation has only grown as more footage and photographs from his campaign trail have surfaced, prompting both concern and curiosity among the public and political commentators alike. One of the most talked about observations has been the visible bruising on Trump's hands. These dark marks, captured in high-resolution photographs at press conferences and public events, have sparked widespread discussion. Some medical experts suggest that such bruising could be the result of minor injuries or even certain medications, while others wonder if it points to underlying health conditions. The fact that these bruises have appeared more than once has only fueled further speculation. Observers have also noted changes in Trump's mobility. He has been seen walking more cautiously, sometimes with assistance or while gripping handrails. On several occasions, he appeared to limp or move with an unsteady gait. Such changes in movement can be subtle, but when viewed over time, they raise questions about possible neurological or musculoskeletal issues. These observations have led some to wonder if there might be a deeper medical concern at play. During speeches and interviews, Trump has occasionally stumbled over his words or paused unexpectedly, sometimes seeming to lose his train of thought. While everyone can have off days, repeated verbal stumbles and memory lapses have not gone unnoticed. These moments have been widely shared on social media and dissected by analysts, adding to the growing list of health-related concerns. Another point of concern has been Trump's facial appearance. At times, he has displayed a droopy or asymmetrical expression, particularly around the mouth and eyes. Medical professionals note that such changes can sometimes be associated with neurological events, such as a minor stroke or Bell's palsy. While no official diagnosis has been made public, these visual cues have contributed to the ongoing speculation. Swelling around Trump's ankles, often referred to as cankles, has also been observed. This symptom can be linked to a variety of health issues, ranging from circulatory problems to side effects of medication. While swollen ankles are not uncommon in older adults, their appearance in a sitting president naturally draws more attention and concern. Taken together, these signs, bruising, mobility issues, facial changes and swelling, could each independently prompt a physician to recommend further testing, such as an MRI. In a patient of Trump's age and profile, doctors would likely want to rule out any serious underlying conditions, especially given the demands of the presidency. Despite these visible signs, the official narrative from the White House remains that President Trump is in excellent health. Spokespersons and the president's physician have repeatedly assured the public that there is nothing to worry about. However, the contrast between these reassurances and the observations made by the public and media has only deepened the sense of uncertainty. As questions continue to mount, The need for transparency regarding President Trump's health, and specifically the details of any recent MRI, has become more pressing than ever. The public, the media, and political opponents alike are all seeking clear answers, hoping to separate fact from speculation in the ongoing debate about the president's fitness for office. The White House addressed Trump's health by announcing chronic venous insufficiency. This condition causes blood pooling in the legs, explaining his swollen ankles. It increases the risk of blood clots, possibly requiring blood thinners. Bruising on Trump's hands could result from anticoagulant medication. This links his venous insufficiency to visible symptoms. The narrative forms: venous insufficiency, blood thinners, and bruising. However, it doesn't explain the need for an MRI. The complexity of his health underscores the call for transparency. The MRI remains a mystery amid ongoing medical management. Despite symptoms, the White House insists on Trump's excellent health. A memo from his physician declared him in great shape, with youthful cardiac age. The report mentioned advanced imaging as routine, not problem-driven. This narrative contrasts with expert views on MRI use. The official stance creates an information gap and fuels skepticism. The public is told of robust health, yet an MRI suggests specific concerns. This dissonance keeps the MRI mystery in the spotlight. Medical experts demand transparency about Trump's MRI. Dr. Reiner and Dr. Gupta question the routine claim, seeking clarity on symptoms. They argue the public deserves to know the reason for the MRI. Historical precedents show the importance of health disclosures for leaders. The White House's silence deepens the mystery and distrust. Experts emphasize the need for honest communication about presidential health. Transparency is crucial for public trust and informed decision-making. The MRI debate highlights the need for transparency in leadership. A president's health is a public concern due to its impact on governance. Openness about health builds trust and accountability. Concealment breeds suspicion and undermines confidence. The MRI's unexplained nature risks eroding public trust. Balancing privacy and public interest is key in health disclosures. Leaders must be transparent about conditions affecting their duties. Honest communication is vital for maintaining democratic trust. The mystery of Trump's MRI remains unsolved, raising public concern. An MRI is for specific symptoms, not routine checks. Trump's visible symptoms warrant such a detailed investigation. The official narrative of excellent health doesn't align with MRI use. Experts demand clarity on the symptoms prompting the scan. Transparency in leadership health is crucial for public trust. The lack of explanation creates controversy and distrust. This case underscores the need for transparency in democratic leadership.